while you are waiting to talk to a nurse.
Global News spoke to 5 workers about their experiences supervising COVID test swabbing for Switch Health and as protecting their identities for fear of workplace reprisal. All 5 say they were hired for the job by subcontractor Blast Marketing.
It says begin test with nurse. That's what they click on before I connect via video. So, and then to be told that I am not a nurse.
Twice, that employee claims they've had to tell patients they're being misled.
I felt like an imposter being in that space.
The federal government awarded a nearly $100 million contract to Toronto startup company Switch Health to manage this system. Switch Health has repeatedly declined interviews with Global News, but maintains most of the telehealth team supervising the testing is comprised of nurses. At most, only 2.9% is not.
Insert the swab.
And while experts say this type of anterior nasal testing doesn't necessarily require the supervision of a medical professional, Ontario says only qualified nurses may use the title of nurse. Violators could be fined up to $50,000 under the province's Nursing Act. After Global News began investigating, on May 12th, Blast Marketing directed some employees in a group chat to immediately start referring to themselves as telehealth generalists and not telehealth nurse assistants. Switch Health says it has since updated its language and informed all employees. In a written statement, it says generalists work alongside its nursing team and have oversight by a registered nurse or registered practical nurse, and that its leadership has never instructed an individual who is not licensed or registered as a nurse to identify themselves as a nurse and is not aware of any record of this occurring.
Blast Marketing says it has no knowledge or indication that any of its team members are fraudulently presenting themselves that way. The Public Health Agency of Canada says it's now aware of such concerns and is actively following up. Roberta Bell, Global News.